Well, good afternoon. Thank you for the invitation to join you. I am speaking on behalf of the school and was asked to highlight some of the outstanding educational practices, and I'm happy to do so. There are many to choose from, and many of our faculty are in the audience. So what I have chosen to do is to highlight three areas. Some application of instructional technology, some things that we're working on in interprofessional education, and some areas I would like you to know about and have a little conversation about workforce advancement. You have seen maybe some publicity about our Atomized Table. This is a product out of Stanford University. If you're interested in learning more about it, you're familiar with the TED Talk series. Google that and look up for somebody named Jack Choi, C-H-O-I, and there's a very nice TED Talk on the use of the table. It's a two-dimensional table. It looks like a giant iPad that you can use to, has a male and female cadavers. You can do a variety of different dissections, overlay, apply different anatomic areas. We're using it and deploying it primarily with our radiation science students. They have not historically done a cadaver-based dissection. You're able to import cases into this into the table. We've used mainly X-ray and CT, and so it's a very nice tool for them to be able to see things in relationship and in three-dimension and in cross-section. Kim Michael and Tanya Custer are here. Do you want to stand up or at least wave your hand? They're the two folks that are using that if you'd like to learn more about it. Another area that we're deploying instructional technology is in the area of virtual microscopy. We use this largely with our cytotechnology students. We have been able to convert the cytotechnology students look at glass slides and do screening. We've converted about 2,000 of those slides into virtual images using the tissue science facility here on campus. And what's nice about this, it's a little hard to see up here, but it allows the students, we can put comparisons next to one another. The faculty can annotate around the slides. They can use it both live in class, and of course, you can send it across the world if we need to from a distance point of view. The cytotechnology faculty, Amber Donnelly, Dr. Mukherjee are in the back. You want to raise your hand at least if you need any more information about that. As a result of this work, both of these groups are doing a fair amount of educational scholarship around these areas, and the cytotechnology group was awarded a grant by the American Society of Cytopathology, the only one in the country to develop a completely online cytopathology course. This is a list of instructional technology. Betsy Becker is here. You might raise your hand. Betsy is rapidly becoming our in-house specialist on the deployment of a number of these commercially available apps, usually at no cost, some minimal cost, and using them to enhance instruction in class, get some immediate feedback, do some real-time engagement, some real-time testing. This is a list of many of the tools that she's used and explored. She'd be happy to talk to you about them if you'd like at some point. I want to mention a couple things about interprofessional education. Dr. Nickel mentioned that, and certainly we're all involved in it. I'm going to share two things that we're kind of at the beginning of talking about, and I share these with you because I think they speak to the question that Devin raised about what's the content and how do we move forward in terms of competency development. So Catherine Jones, is Dr. Jones here? I didn't see her. She's actually a master trainer for the Team Steps, the National DoD ARC training on communication and trying to reduce medical error. She's worked with a number of critical access hospitals, pharmacists, therapists, nurses, trying to improve workflow and decrease errors in critical access hospitals. They've also deployed this training in our PT program. We're talking about trying to figure out strategies to deploy it across our various programs so that all of our students would be able to leave with some of these competencies. The other thing that we're working on that we're very excited about with Dr. Liu and several of his colleagues, there's a huge shortage of mental health, behavioral health providers in Nebraska and nationwide. We're developing some, with PT and PA folks mainly, some modules, and with the idea of maybe putting them together for a certificate, thinking about how do our PA and PT personnel interface with patients in all the areas that they treat, where they need to have greater understanding about diagnosis, surveillance, triage for referral related to mental health issues and behavioral health. So those things are forthcoming. Lastly, I just want to make a quick comment about workforce development. So I don't know, this is kind of a well-kept secret in the School of Allied Health. We have 175 health professionals across the nation enrolled in our degree, what we call degree advancement programs. They actually represent about 30% of the total enrollment in the school. So these are programs where in the allied health professions, you probably appreciate a number of folks enter with one degree, and they are often associate degree, certificate-based, some bachelor, but the programs that we now offer have master's or bachelor degree programs. And so for people who have a MLT, an associate degree, or a certificate in radiography, they maybe have entered the profession with a BS in physician assistant studies or perfusion. We offer them a mechanism to advance their degree while staying in their community of practice at their place of employment. We deliver the didactic information. They do their clinical experiences under our guidance at their home site, and then they have we advance their competencies, but also keep them in place. Thanks. Jan Tompkins is the director of that program, so if you want to know how we do that, we're happy to share that with you. That was the end. Thanks.